Let's take a look at the latest. In-house this morning, we have special guest, Dr. Harrington. Good morning, Dr. Harrington. How are you doing?
Good morning, Eric. Great. Good to see you.
It is good to see you as well. So a lot has happened since our last conversation. Let's dive right in. What is new?
Well, nationally, of course, we're paying attention to the rising cases in many states. And Steamboat is unfortunately not able to be disconnected from what's going on around the country. As we've seen through our cases here, many of our cases involve people who've traveled to some of these hot spots and in return and they're sick with it. So we're connected to those places. I would say that our case count over the past 4 weeks on average has stayed fairly stable. It certainly has not trended down, but I also don't think that I can make an argument that it's gone up significantly either. So that might be good news. We did not see quite the surge that we might have expected after July 4th. So here we are on the 23rd, we're 19 days out. We expect that when people are infected with the virus, that they get symptoms on average within 5 or 7 days. They tend to be admitted in about 14 days or so. They tend to be critically ill and other things in about 21 days. So we're at the point where we might have expected to see more of a surge if we're going to have a problem from our July 4th weekend. And so far have not seen that, which I think is good news. The challenge for us, of course, is we have, well, there's many challenges, but we have this ongoing level of disease in our community as we start to get into August when we're going to hopefully open schools. And then soon after we start to see the cold and flu season begin. And it would be ideal if we could enter those scenarios with a low prevalence disease in our community, and we're not there. We continue to see different patterns with our cases. We looking at the age group range, and I want to caution this by saying I'm not trying to target or shame or pick on any particular group, but the facts are that approximately 2/3 of our cases here in the past few weeks have been in those in the 30s, 20s, and teenage groups. And that's consistent with what we see around the country. Now, there may be a good news story out of that, and then that would suggest that our older patients, those who are more vulnerable to the complications from this virus, they are doing what they need to do and are keeping from getting infected. But then it means that we need to also focus some of our messaging on our younger age groups too, and remind them the importance to the rest of the community that everybody do their best to prevent the spread of this disease.
So one thing that has happened since the last time that we spoke was we received a notice that bars will no facility will be able to sell alcohol past 10 p.m. Can you speak to that a little bit?
Well, when we tackle this disease, we can, so we take our place today, we can add new measures in. So we could peel back some of the openings we've done. We can put new restrictions on, or we work on the other part of it, which is just to do better with the measures we already have in place. And I think it's prudent that our state and locally that we act before we get into a crisis point. So with rising cases, the governor and the state have chosen to act in I would say more than a couple ways, but the things that we all saw here recently was he instituted a public mask wearing health order for the state. And then in addition, he just made this change with the bars and restaurants throughout the state. And so those are all steps to try to keep businesses open, but to reduce the spread. I mean, it's kind of like that adage that if you expect to have a different outcome, but you don't do anything different, then you're not being very wise. So I think with that kind of an idea in mind, the state has not accepted our rising cases, and therefore they made some steps to try to reduce that. And rather than having to go to bigger efforts that we hope to not have to take with different businesses. This is summertime, and I acknowledge that for a lot of our local businesses, this is a key income period. So I think it's important that we get through this summer period and businesses can, to some degree, carry on their regular business levels and kind of replenish bank accounts, so to speak. So we think that that's important, and so that this where's the fine line? How do we do things to reduce this disease, but yet also allow our economy to continue and activities?
Yeah, I can appreciate that it's not so black and white. It's not on or off or open or close. It's let's tweak it to make it fit our local scenario.
Yeah, and I have confidence that our measures can work. There's evidence that suggests if we just practice our social distancing, wear our masks, wash our hands frequently, we could actually keep this disease in check. Now, we'd need to do those things at a high level, but I think that's possible. It was public here last month that they had another positive staff member over at Casey's Pond. Since we've done 2 complete rounds of testing of staff and residents since then and not found any cases. I think that points to the fact that if you do follow proper protocols, and certainly at our long-term care facilities are doing all that, that makes a difference and we can prevent the spread of this disease.
Excellent. And in wrapping things up, Dr. Harrington, is there any last thing that you would like to let everyone know?
We need to, well, we've said this before, we got to keep working on it. And the predictions are still that we're going to see increasing cases. But if we can do well at the measures we already have in place, I'm hopeful we don't have to do other things. And it's becoming important as we look at the opening of school this next month. We want kids to get in the classroom. And a key factor for whether it happens or not, both in the state level and locally, is how much disease we have in our community. And we all have a vested interest in our kids' safety and the safety of our teachers and all. But I know that a lot of people, they need their kids back in school so they can work.
Thank you so much, Dr. Harrington, again, for taking time out of your morning to join me on air today. I really appreciate you keeping our community well informed.
No, and you're serving a role for the community. It's important that we get this information out and have a chance for people to hear more about the disease and what our efforts are to reduce its spread. So thank you for having me.
Of course.